On behalf of County Judge There we go. Okay, let me repeat that. So on behalf of County Judge Barbara Canales and Mayor Joe McComb, I'd like to welcome everyone to this special news briefing to announce the joint project to create prediction modeling for the local effects, that means in our community, of the COVID-19 pandemic. The City of Corpus Christi, Nueces County, and Texas A&M University, which is right here in Corpus Christi, partnered together to create a model to predict the number of cases of COVID-19 that we would have in the coastal bend and the impact to local hospitals, and to show why to the community, why it matters for us to follow federal, state, county, and city stay-at-home and social distancing orders. Today's briefing and report is the beginning. It's only one of many that we'll share with the community as days and weeks go by. We are fortunate to have such a strong asset of Texas A&M University here in Corpus Christi. I want to thank President Miller and Dr. Mahdi, the Vice President of Research at the university. Last week, when I reached out to them for assistance on this project, it was without hesitation that they assembled a team of research scientists to help our community better understand and project COVID-19 infections and their impacts that they would have in our regional medical facilities. In addition to our partnership with the university, I want to thank other public health, medical community personnel that have helped to collaborate in this initiative. That includes Hillary Watt and her team at the Coastal Bend Regional Advisory Council, Public Health Director Annette Rodriguez, and our Assistant Public Health Director, Dr. Dante Gonzalez, and other professionals in the health district. And there's many more in the public and health fields that have helped make this project come to light today. I want to particularly thank the incredible team of experts that have collaborated over the past week, literally around the clock, to be able to share this information with the community. This information is for the community, so we can see here locally what it means for this pandemic and how we can follow social distancing and stay-at-home orders and why it makes a big difference. We have two university scientists with us, researcher scientists with us here this afternoon that are going to present the presentation. And we would have had more. Their team's pretty big, but because of the stay-at-home and the social distancing, they chose not to come to today's event. With me today is Dr. Philippe Tussaud and Dr. Chris Bird. Both are from Texas A&M University. Dr. Tussaud is an interim director for the Conrad Blucher Institute at the university, and he's an associate research professor as well. His main research interest is the application and development of machine learning-based techniques. Machine learning-based techniques. I had to ask staff what that meant, and they told me what it means is he's very smart. So, all right. And then Dr. Bird is with us too. He's an associate professor of biology in the College of Science and Engineering. And his research focus is on using molecular genomics to advance our understanding of marine species and to promote sustainability of marine ecosystems. We're grateful for both of them for being here today. And with that, we're going to turn it over to Dr. Tussaud.
La ciudad de Corpus Christi, el condado de Nueces y la Universidad de Texas A&M se reunieron y crearon un modelo para predecir el número de casos en el área de la costa y determinar el impacto en los hospitales locales dependiendo de las medidas de mitigación que también se siguen y las características de nuestra población local. Además de nuestra asociación con la universidad, quiero agradecer a otras organizaciones comunitarias, médicas y de salud pública que han colaborado con el equipo de investigación y continuarán brindando información y orientación a medida que continúe este trabajo de modelado. Hilary Watt y su equipo del Consejo Consultivo Regional del Área de la Costa, la directora del Distrito de Salud Pública, Anel Rodríguez, subdirector Dr. Dante González y nuestros profesionales del Distrito de Salud. Y muchos más en los campos de la medicina y la salud pública que han hecho de este un verdadero proyecto comunitario. Este trabajo es increíblemente importante para quienes toman decisiones. Nos brinda herramientas de planificación para evaluar posibles medidas de mitigación para reducir la propagación de la enfermedad. Tenemos un par de esos investigadores universitarios con nosotros aquí hoy para presentar el trabajo hasta la fecha. Así que hoy tenemos al Dr. Philippe Tissot y al Dr. Chris Bird aquí con nosotros. El Dr. Tissot es director interino del Instituto Conrad Blucher y profesor asociado de investigación. Y su principal interés de investigación es la aplicación y el desarrollo de técnicas basadas en aprendizaje automático. El Dr. Bird es profesor asociado de biología en la Facultad de Ciencias e Ingeniería. Y su investigación se centra en el uso de la genómica molecular para avanzar en nuestra comprensión de las especies marinas y promover la sostenibilidad de los ecosistemas marinos.
Good afternoon. So you'll notice that I'm modeling. I've got my mask. That's the first time I'm going to talk in public with a mask, so this is going to be interesting. It's a little blend. I saw somebody in the public who had a great one, so I'm expecting that in town we're going to have masks that have different colors, different things, so I'm looking forward to that. Big thank you to Mayor, Judge. When last, a little more than a week ago, we were called, we were delighted to try to help and give you the best information that we can. And it's been a pretty intense week. It's been fantastic to work with our city colleagues here. Got Steve Vieira, Karen Costanzo, Dan McGinn, I think there. And it's a team of 15, 20 people, the university, the city, the county, local hospitals. We look for information. We look for different models. My colleague Chris Bird will go through the modeling part. And we also need the best information from the hospital, from the community, from the testing. And this requires a team to figure it out. And so far, it's been, under different circumstances, it would be pretty cool. But it is for sure, it was exciting, interesting, and we're ready to push some more and give you the best information that we can over the coming weeks and longer. So this particular, the focus today is modeling. So you're going to see the first prediction just for the coastal bend. And we went for the coastal bend because if you're in trouble in the coastal bend, you're probably going to go to the hospital here in Corpus Christi. And we're very interested in what can we handle with our hospital infrastructure here in Corpus Christi. And so that's going to be the focus, predicting cases, hospital utilization from the whole coastal bend here for the hospitals in Corpus Christi. So that's going to be a big focus. There's other things that are going in the background. Several other colleagues who are working on that information pipeline to get the right information for the models, things that are directly from here, from the coastal bend, from Corpus Christi. And that's probably going to come up in the next weeks. But so today, it's the presentation is going to be maybe a little long for what you have, but we want to give you the science. We want to give you the fact. We want particularly for the media, we really need you to give the best information possible to the population, where we are, what it is about, what it's like, why were the measures, and thank you very much for the measures that you took. Why were those measures implanted, and what would have happened if we didn't? You'll see comparison for that. So it's going to be a little longer there. Dr. Bird and myself will be available after the presentation for any kind of questions. And also, if you're a member of the media and you think that we're a little too sciencey or our graphs are a little too, et cetera, tell us. We're ready. You know more how to communicate the information. We know more about the science. We'll listen to you and to calibrate the best we can a model such that everybody understands where we're at. So with that said, I think I'm going to let my colleague, Dr. Bird, and he's going to show you the first predictions for the coastal bend. Chris.
Thank you, Dr. Tissot. Before I get into the report, I just want to acknowledge that there was a very large group of people that are working on this. The task force was created by Judge Canale, city leadership, including city manager Zanoni, The president of TAMUCC, President Miller, and Vice President Mahdi. Many organizations and people contributed to this work, as Dr. Tissot said, and we assembled a fairly large team at the university to turn around this product so rapidly. As Philippe noted, it's kind of an invigorating process. We have been working around the clock, and we did that so we could bring this to you as fast as we possibly could. So the region covered by this report is the Texas Coastal Bend, the 12 counties. I'm not going to list them off, but you can see that there. Probably one of the first questions that you might have is, what does the trend and increase in cases in the Coastal Bend look like? It looks like this. We have 89 laboratory-based confirmed positive tests in the Coastal Bend area. We have a heat map here of the Coastal Bend area. Don't miss the 2 over there in Aransas. I thought there was an error in the graph earlier, but it was just too hard to see over there. You can see there's a pretty steady increase in that graph. So what it looks like is, for right now, there's no sign of plateauing, and the number of cases is increasing at a steady state for the past couple weeks. So we had 2 objectives on the task force. We were going to try to take this data and any other data we could find from around the Coastal Bend, around Texas, the United States, and the world to try to parameterize models to answer 2 basic questions. One, we want to address public concerns and questions about COVID-19 and social distancing. And 2, we want to provide evidence-based information for decision-making to our leaders in the local area and beyond. Pressing questions that we addressed: 1, what would have happened if we had never enacted social distancing? Would it be any different than it is right now, except for us all being under stay-at-home orders and having our lives turned upside down? 2, what would happen if we ended social distancing orders today? It's been a long time, it's kind of inconvenient, and a lot of people are out of work, and we need to kickstart the economy. We're hearing that message, right? 3, is social distancing working in the Coastal Bend? And 4, what would happen if people ignored the social distancing guidelines over the impending holiday weekend? As everybody probably well knows, there's 3 prominent religious holidays this weekend, and I've seen and heard a lot about people thinking that, well, we're just going to have our parties anyway. So we decided that that was a relevant question to address for right now, today on Friday. I got to show a little bit about where this information came from. If anything, this is there so that later on, if you want to look up where these models are, you can find them and read about them. 3 of them are open source. You can download them from the internet onto your computers and run them yourselves like we did. We have the Imperial College model, which may sound familiar because that's the group that's working out of England that was really out ahead of this thing in the first place. The COVID-19 scenarios model from Switzerland, the CHIME model from University of Pennsylvania, and the IHME model, which is another major one from the University of Washington that the White House is using directly to make decisions. So we applied all models to these questions when we could, but they couldn't all answer or address all the questions that we asked. So the way we're going to present the data is maybe slightly different than what you see on TV, where they show you just one model's output. We're going to show you the combination of up to 3 different models simultaneously. But I want to calibrate you, because what I learned through this process, I'm a marine biologist, I'm a population geneticist, I've modeled the invasion of the Atlantic Ocean by the lionfish, which is similar to modeling the invasion of a virus, but I wasn't up on the literature, so I had to do a lot of reading, and this is what I figured out. You stop a pandemic, 1, by putting it out before it gets out of control. It's like a campfire at first, and a campfire is easily put out. But if you let it go and you let the fire get too big, then it can be really hard to put out. And that's kind of akin to this coronavirus and the pandemic we're facing right now. In Texas, we estimated the transmission rate. This is the most important parameter to estimate. It affects everything in the model. It's the most strong parameter that we put in the model that affects all the outcomes. And this is maybe one of the major achievements that we did over the past 2 weeks, because this number is not out there publicly, and we use the imperial model to estimate it from the death data from COVID-19 cases in Texas and 4 Texas counties. So the upper transmission ratio, which is the number of people that get infected for each person that gets infected. So if you get infected with COVID-19, how many people do you pass it on to? If no social distancing, no stay at home, that number is 4. And that's a terrifying number to pandemic scientists, I can tell you for sure. So this is a serious, serious thing. COVID-19 will spread if that number is above 1. And our estimated transmission ratio overall for Texas is 2 to 4. So within the 95% credible interval bounds, which means we're pretty darn sure that it's somewhere between 2 and 4, it's not below 1, just without any additional measures. Goal of social distancing is to change this parameter. As the modeler and as one of the team of modelers, this is the thing that became very clear to me over the past week, week and a half, is that the goal is to get this number below 1, or at least get it to 1, so we can hold things in check until vaccines come into play or medicines, and we can maybe figure out other ways of suppressing this number. So the estimated transmission ratio in Texas with social distancing is 1, with a confidence interval from 0.2, which would be great, to 2, which is not great. And you might be wondering, how were we able to do this? There was a study of 11 countries internationally done by Imperial College, where they estimated the effectiveness of each social distancing measure that was put in place. We applied that here to the state of Texas and were able to independently derive a value for the effect of social distancing. So what that should tell you is it's kind of a 50-50 proposition right now. We're right on the tipping point between beating this and it's spreading even more. And I want to point out that this was a worst case scenario where 4 is that upper range, and it's pretty good chance that the number is between 2 and 4. But if it is 4, we want to plan for the worst and not plan for the best and then get the worst. So that's why we modeled the way we did. So just to review, transmission ratio 2 to 4, that's really high. We want to get that down to 1. With social distancing, it gets it down to 1 plus or minus 1. So we need to be more certain about what's going to happen in the future. Right now, like I said, it's approximately a 50-50 proposition whether it's going to spread more or whether it's going to go down in Texas, according to the data we have right now. Also, there's uncertainty, obviously, in the effectiveness of social distancing. We're using a model that came from Europe, but it's the only one that's available in the world right now. And we're not sure how it's different here. We're hoping that maybe we can use cell phone data to relate it to these social distancing efforts in different places, and perhaps there'd be some sort of correlation that we could use to further tune to our local area. All right, so we took a conservative plan for the worst tact with this, and we're going to get into the results of the modeling now. Social distancing. And when we were giving preliminary reports, nobody knew what mitigation was, or we were told, well, what's an intervention? But everybody knew what social distancing was. So you're going to see the word social distancing in this talk. But what we mean is everything that we're doing to try to decrease that transmission ratio below 1. Stay at home, closing schools. As soon as you get sick, don't go out in public anymore. Self-isolate, hygiene, wash your hands. I've never washed my hands so much in my life as in the past 4 weeks. And laboratory testing. These laboratory tests are shown to be associated with decreased RO values, or decreased transmission rate values. Because if you know if somebody has it, then they can isolate, right? And if you don't know, then somebody might think, well, maybe I just have the flu and won't isolate. So here's the scenarios that we're modeling. 1, in red, no social distancing, which means never. What would have happened if we never put in any social distancing measures? no stay at home, no closed schools, no social distancing, no closed businesses, no too many people, no limits on the number of people in public or how far apart we can stand. That's 1 in red. 2 in blue, end social distancing right now, today. Literally, that's what we modeled. What would happen if we ended social distancing today, Friday, April 10th? And we would presume that we had the social distance that we had in place, and let's lift it and see what happens. 3 in green, keep social distancing for the foreseeable future. What's the foreseeable future? Well, until we can project in the future when it's not going to spread for sure. So that's maintain the present mandate. We didn't add any more and we didn't subtract anything, just maintain the present level of social distancing as best that we could estimate it. And one more time, plan for the worst. What if it's 4 here in Corpus Christi, that transmission rate, and not 2? So here's our curve. This is what you've seen on TV. It might be a little bit different, so I want to calibrate you to it. I had this animated, but for some reason it's not animating. That's fine. So I put these arrows on here to calibrate you, like what's going on here. It's not like what you saw on TV, but just a thicker line. It's showing you where the uncertainty is. There's 3 models that are going into this projection of the projected daily census infected. So what this means is that somewhere in mid-April, if we did nothing, no social distancing measures, no stay-at-home order, we project that right around the middle of April, there would have been about 300,000 cases of corona, COVID ID 19 in the Coastal Bend area, and that would be on that day. So the lower estimate that we have from some of the other models comes out to about 96,000. There's about 600,000 people in the Coastal Bend area. When you run this out, essentially about 90% of the population gets it, and you'll see pretty soon what effects that has downstream. Once again, we're doing that transmission ratio of 4. Moving forward. This is what happens if we end social distancing today. This is what the models predict. This is also based on the same 3 models. Projecting out from today, you see the presentation, decide what I saw means that we should lift social distancing orders. The peak goes down slightly to 200,000 people infected at the peak, which occurs somewhere between mid-May and early June in these projections. And the lower end of that interval is somewhere around 92,000 people at the peak. This is not the total number of people that get infected. That's the number of people infected at the peak. So you're looking at the majority of the population contracting COVID-19 under the end social distancing today mandate, which would be all measures. 3 in green, we have to keep the social distancing that we have in place, and what you see is that there's still a curve, but it's the flattest curve that we have on the screen right now, and its peak is below the best case scenario if we lifted social distancing orders right now. So we have a range of somewhere from 10 to 87,000 people being infected at the peak, with our estimate of worst case scenario, our best estimate of the transmission ratio for Texas. Now what you're seeing here is, notice that this has gone down. Sorry, this is not going to point for me. But now there's only 2 people for every 1 person getting infected in this keep social distancing scenario. And so that would be the effect that it has. And because it's only come down to somewhere around 2 or 1.8, then we can push it out into the future a little bit more. Okay, so social distancing is flattening the curve here. And this is worst case. In the worst case of worst case scenarios, we have 87,000 cases instead of 300,000 cases if we never did anything at the peak, or 200,000 cases if we ended social restrictions right now. And so it looks like the best alternative of these 3. And notice that there's a thick green area here where we could be way down near the bottom here with a very flat peak. Okay, social distancing is going to prevent a disaster at the hospitals. So if you look at this graph, you're calibrated to it now. It's just like the last one, except here we have the hospital projected daily census. That's the number of people at the hospital, or at least that would be at the hospital if there was an available bed on that day. At the peak, where we're looking at over 12,000 for the no social distancing ever, end social distancing today, we're somewhere around 11,500 at the peak, down to 4,000. And with keep social distancing in place, notice the capacity line right here near the bottom. We stay well below it, at least out till July in this projection of the worst case of worst case scenarios. So the social distancing, if we're doing a good job of it, seems to at least buy us some time until we can figure out a way to maybe decrease it more, or new information comes to pass that in Corpus Christi, maybe we have a little bit lower transmission number than the average for Texas. Or maybe we have a little bit higher one, we really need to do more than we are. Okay, so we're gonna recalibrate you to a new graph. This is the cumulative number of fatalities predicted under the 3 scenarios. What if we had never done social distancing? What if we end social distancing today? And what if we keep social distancing? And what you see is that we have the projected cumulative fatalities. So what this means is at the end of the curve, we're looking at over 5,000 projected fatalities for what would happen if we did nothing. This is what the model, this is based on one model, because this was the only model that could do this projection. This is what it predicts. For the end social distancing, it just pushes it off into the future. We end up with the same basic outcome, and we delayed it. With the keeping social distancing in place, we can push it off into the future a lot farther, but it's still increasing. And until we can understand how to get that transmission ratio, a better estimate of it, to know really what's that ratio in Corpus Christi. And I kind of hope that we can't ever calculate that number, because the only way to calculate it is from the deaths from COVID-ID. That is the best way to calculate it statistically, because we don't know how many people have the virus and are asymptomatic. We don't know how many people have COVID-ID and aren't getting tested, and all these things make it impossible to calculate this value almost any other way. So overall, that number of deaths averted, over 4,000 deaths averted just to the middle of June, and even more than that. But in the future, it's kind of hard to tell, but it is going up at the end. It's a good time to point out that as we go from here over to there, we get less and less certain, right? It's just kind of like anything else. The farther you go out into the future, the less certain you can be about it. What I can be fairly certain about is that there's a huge difference here between these scenarios, and even if we're not as good at social distancing as we think we are, it still seems like there's going to be a pretty big difference between these scenarios. Okay, the holiday scenario for the weekend. What happens if we all decide, well, you know what, it's a holiday, let's take a COVID ID holiday, and let's end social distancing, and we'll have a party, what could it hurt, right? I mean, it's the holiday. We need a pick-me-up. So this is what we figured out from our models. This one's based on more than one model. You can see from the thickness of it that there's more than one line going into this graph. So this data is coming from that model of the state of Texas and the 4 counties in Texas where there's enough fatalities to estimate their transmission ratio well enough. And by mid-June, what we're looking at is about 5 to 20 more fatalities if nobody in the coastal bend area obeys the social distancing orders this weekend. And I know that's an extreme scenario, right? And that's definitely not going to happen. But the question here is, like, what could it hurt? What if we just lifted it, even for a short period of time? Because I've heard people talk about that just in my own, everyday life. And so we thought it was an interesting scenario to just see if the models could even tell the difference from 0. And it seemed that they could, and there actually would be a tangible difference. And the farther out you go, the bigger the difference is. You can see it doesn't stay flat, it increases the farther out you go. Okay, so here's our summary of this. Social distancing is likely to be decreasing the impact of COVID-19 if we're as good as the average country that was studied by the Imperial College in their report 13. We took a conservative plan for the worst approach. We assumed a baseline transmission ratio of 4. I hope that I've done a good job of communicating what that means. It means 4 people get infected by every person who becomes infected. That is a very rapidly spreading disease. As we see in a place like New York City, their RO there is probably much higher. I've been to New York City a few times. I can't walk down the street 10 seconds without touching about 20 people, and their RO is going to be much higher. Here, ours is lower, so we're not necessarily looking at that kind of situation that they have, but if we wait long enough, it does take off in our models. The models indicate social distancing leads to substantial reductions and delays in the number of infections, decreases in hospital and ICU overflow, and fatalities. Continuing to obey social distancing guidelines over this holiday weekend is estimated to avoid between 5 and 20 COVID ID deaths by mid-June. And I know, like every time we show this slide, something that we hear is that, well, there's no COVID ID deaths in the coastal bend yet. Let's talk next week on that. I've seen all the statistics, all the statistical tables. There's 3 people in the ICU that are there for COVID ID, and 2 of them are over 70. There's about a 40 to 50% chance of fatality if you're in that range. So 75% chance that we see it pretty quickly here. All right, summary: too soon to stop social distancing. That's, I think, the main message here. If the estimated effects of social distancing are removed today, I think it was very clear what the outcome is going to be, even in the lower end of things. Even if we were at the lower end of Texas for 2, which we didn't model, but you're still going to get a peak when that happens. The hospital and ICU capacity are projected to be overwhelmed, and it's not by 1.5x, it's by 5x, 6x, it's a lot. And my sister's a medical professional, and she just keeps telling me, you have to have, the hospitals have to operate. You have to have that operating, because if you don't, the community is going to be in big trouble. So we really want to avoid that. The models indicate that the transmission ratio is straddling the tipping point. If we go with the median estimate for Texas between increasing and decreasing. If you look at our local case data, it's still going up, but there's delays, right? And how long it takes to get the test and how long the test comes back. So we're looking, 5 days in the past, 10 days in the past. Maybe some of the people in the room know better than me what that number is. But I know it's not very quick. And by next week, we'll maybe know what was happening more this week. So we're right there on the edge. The best way to put out a fire is to not let it turn into a forest fire. And if you have the ability to put it out and rather than walk away, that's what you want to do. And that's the best analogy that I can give to this, because once you let the fire get out of control, it's very hard to rein in. So I was supposed to stop, right? You want me to stop now?
En resumen, el distanciamiento social es muy probable que aminore el contagio por el virus. El radio estimado de la transmisión del virus en Texas es de 2 a 4. El distanciamiento social se estima disminuya el radio de transmisión de 2 a 2. El brote se extinguirá si el radio de transmisión es menos de 1 hasta que todas las personas sean asintomáticas. Tenemos un plan conservativo para planear en el peor de los casos. Los modelos indican que el distanciamiento social lleva a reducciones sustanciales y retrasos en el número de infecciones en hospitales, unidades de cuidados intensivos y decesos. El continuar obedeciendo las reglas del distanciamiento social durante estos días festivos se estima que evitará la muerte de 5 a 20 individuos debido al COVID-19 para mediados de junio. Muy pronto para detener el distanciamiento social. Si se detiene el distanciamiento social hoy, el número de infecciones y muertes estimadas se proyecta aumenten entre mayo y junio. La capacidad en los hospitales y unidades de cuidado intensivo serían abrumadoras. Los modelos indican que el radio de transmisión en su punto más crítico entre el incremento y disminución dependiendo de qué tanto sigamos en el distanciamiento social y el verdadero radio de transmisión.
So, when can we lift social distancing? This is a common question that I've started to hear in the past week and a half since I joined this task force. And here's the answer. The more that we do to decrease that transmission ratio, the faster we put this out and the faster this ends. The present levels of social distancing, they might be enough. We have plenty of scenarios that come out with a low peak, and as long as we have the current level of social distancing, but there's a lot of variability that's going into that information. I'd be lying if I told you that I know here's exactly the effect that social distancing has today in Corpus Christi on this. I can just give you a more broad range that in general across several different societies, this is the average effectiveness that the measures we've taken have had. There's too much variation in the inputs to project a safe end date right now. I think that's pretty clear. All of our models near the end in some of the scenarios are starting to peak up, even the green ones with current levels of social distancing. And new information is becoming available every day. The programs that we're using, they become updated every day. Every time I run it, I have to pull down a new version of the software because it's constantly being updated. There's new information that we're putting into the model every day. New studies are coming out every day that we can use to better parameterize the models to know what's happening or know what's going to happen a little bit better in the future. And so right now, with that degree of uncertainty relative to the amount of information that we have coming in, and we learn so much more each day, it would seem that right now we're not sure when we can end it, but we know that today's definitely not that day based upon those blue curves that we showed. So social distancing saves lives. It's important to follow the guidelines that the governmental agencies are putting down, are telling us. It's not just something that they're doing offhand. There is solid science underneath it, and maybe unlike you see on TV, I've tried to reveal to you exactly what we're trying to do here. These orders are only effective when we choose to engage in them. This is the first time I've been out in public with a face mask on, just like Dr. Tissot. I admit it's pretty uncomfortable, but I sent an email during the initial lockdown press conference to some of you that are in the room saying, well, why didn't you social distance when you issued the social distancing order? And I'd be a hypocrite if I didn't get up here and wear a face mask at this point. So a vaccine would likely change the need to implement social distancing orders, medications. We don't know on those fronts what's going to happen in the future. We want to try to push this off if we want to try to prevent those hospitals from overflowing and the fatalities that could occur if we let this get out of control. I'll say it again, I said in one of our other meetings, I'm very proud to be from Corpus Christi right now because how well I think it's been handled so far. I've lived in several places around the country, and I don't think any of them handled it any better than we have. So I think it's pretty great what's happened so far in terms of the action that's been taken, and I know there are hard decisions that were made. We can't allow this wave of potential COVID-19 hospitalizations. We need to get to a point where we're pretty sure that that's not a possible scenario for our future. This requires current social distancing orders are maintained until those hospital numbers, projected hospitalization numbers can be reduced if possible. You can help by following the CDC guidelines, following the government regulations. Wash your hands often. Everybody knows the 20 seconds at this point. We kind of all know the drill. Why am I wearing the face mask? Because I ran the model, I could see we might be right at that tipping point. I'm not sure if this is going to get put out, but I know if I wear a face mask, it's more likely to go out quicker. This is more likely to end sooner. And I've seen the data over the past weeks, I've read all the reports, and this is the decision that I made for myself. The CDC and the president have recommended that you wear face masks out in public, and that's probably the way that we can crank up that, or crank down that transmission ratio below 1. Thank you.
¿Cuándo podremos de manera segura dejar la orden del distanciamiento social? Entre mejor sigan los residentes la orden del distanciamiento social, más rápido el brote del virus será extinguido. Los niveles de distanciamiento social deben ser lo suficientes y son seguidos. Existen muchas variaciones en los modelos para estimar una fecha segura para dejar el distanciamiento social, pero hoy no es el día. Cada día hay información nueva y estimamos que las variables en el modelo disminuyan cada vez que tengamos nueva información.
Okay, great. That concludes our presentation for this afternoon. I was looking at the Facebook feed as the presentation was being taken. Some of the questions that I've seen are, is the PowerPoint available? And it is available, right? It's on the Blucher website. Okay, it's at Texas A&M University's website. We'll have a link on our website to this presentation. Another comment I did see is it was a little tough to hear because of the face mask, which is no problem. And you were covering a lot of material quickly. But the response to that is look at the presentation, go through it slowly. It's pretty, it's easy to interpret without a professor telling you what the slide says. And the most important thing is that the concluding slides, the text slides that have the bulleted text statements, that's basically what the graphs show. So you don't have to understand the graph so much as just to be able to read those bulleted slides that are towards the end of the presentation. That'll help you understand what was just presented. Another comment is that this is one of what will be many presentations. This is not the final end-all presentations for what's going on with COVID in Nueces County. But this is a beginning point. It does show some pretty dramatic impacts of how by us following the orders that have been put in place of social distancing and staying at home, why it matters. The maps and the graphs that were shown have extremes on ranges, the very low and the very high. They've done that from a scientific standpoint. But I think even without thinking that it's the highest peak, there's still evidence, a lot of evidence that shows social distancing, staying at home, following the orders that have been put in place by the county judge, the mayor, the governor, and the president make a big difference. The mayor is here, the county judge is here, they're in the audience, and then our professors are here. So at this point, we'll turn it over to any questions that the media might have to help the public better understand the presentation.
It sounds kind of dire, but I'm drawing from the graphs and whatnot. Best case scenario with social distancing, we're going to see 10,000 cases in the Cholla County area and 1,000 deaths. That's the estimate?
No, that's not, I think I was pretty clear in that everything that we did was worst case scenario with starting off with the 4 of the transmission rate. So that 4 with the social distancing, we get it down to about 1.8, but if we're at a 2 baseline, that would bring us slightly down below 1. So the best case scenario is that there's several scenarios we're running where it could be going out right now, but there's a lot of scenarios we're running where it does not go out, it goes the other way. Yep.
It seemed like every graph was around June, July. We started seeing an uptick. Is with best practices, social distancing, that's when we should peak, you think? Or do we have an estimation? Well, I guess you kind of said we don't have an estimation on when the peak could come.
Right. That's what would happen if all of the social distancing was ended today, or the red was if we never put into place in the first place. So the green is really the scenario that we're in. We didn't stop the social distancing. We kept it going all the way out. Next week, 2 weeks from now, hopefully we get better information and we can give you a better prediction of what's going to happen. But right now, there's no way to predict when it's going to end. But it's very easy to say that right now it's going to go up if the social distancing ends, even if we're on the good side of that transmission ratio.
Given the feedback, I think maybe a great idea would be at your home, you can put a webcam on yourself and maybe repeat the great presentation, and then we'll post it to YouTube and load it on nuecescounty.com and link it to the city. And you just run through the presentation exactly the way you did it in your home, free of the mask, and in a manner that I think people can share with their other family members. And I just want to say thank you on behalf of Nueces County. Data drives policy. You've just proven why the policy is supported by the data. And we're very grateful, and we look for more information to continue good policy making. Thank you.
Thank you very much.
Okay, was there any other questions or comments? Okay, well, that concludes our press briefing for today. We thank you for watching. We won't have our normal 5 o'clock. This covers it, but we will be releasing the number of any additional COVID patients that tested positive and any other data that we normally put out every day around 4:30. That'll be put out as well and made available to the community and the public and the media. So we'll see you back here on Monday, and you all have a safe Easter weekend. Thank you.